Come in.
Hi, my name's Tara. I'm going to be your nurse today.
Nice to meet you.
So can I just have you confirm your name and date of birth for me?
Christian Kenny, 9894.
Okay, I'm going to check your bracelet. All right, that matches up. So today we're going to do a head-to-toe health assessment, and I'm just going to start with a few questions, okay? So first of all, can you tell me if you use any assistive devices?
Nope.
And do you have any pain right now?
Nope.
Okay, on a scale of 1 to 10?
0.
And so no pain. And so now I'm just going to ask you a few questions. Do you know where you are?
Saco, Maine.
Okay, and can you tell me what month it is?
November.
Okay, and so a patient is alert and oriented ×3. She has clear speech and is able to verbalize and convey her thoughts well. Her posture is erect, and now we are going to test your short-term memory. So I am going to give you 3 words, and I'm going to ask you to remember them at the end of the assessment, okay? So we're going to do shell, car, and boat.
Okay.
And so now, before I begin, I am first going to test your sensation, okay? So what I'm going to have to do is have you sit there and close your eyes, and I'm going to ask you to tell me where I am touching you, okay?
Okay.
All right, so,
Right arm. Left arm. Right thigh. Left leg. Left thigh. Right leg.
okay, so patient is able to discern where someone is touching her. She has good proprioception, and sensation is intact. And now I'm going to go ahead and test your muscle strength. So what I'm first going to do is have you press up against me, and then down. Good, and now I'm going to have you hold your arms out and press up against me, and down. Grab my hands. Okay, now push up, push down. Perfect. And now I'm going to do it with your legs. So push down, now push up, push up, push down. Okay, so patient has strength 5 out of 5. This is normal. It is the same bilaterally. There's no problems with muscle strength here. It is intact. So now I'm going to begin at your head, and I'm going to start with inspection. So upon inspection, I can see that your head is appropriately sized, placed midline, no deviation, and then your facial features are appropriately sized and placed on your face. And I'm going to begin by palpating your scalp for any masses or critters. I can see that your hair is thick and evenly distributed. When I palpate, I see no masses. I feel no masses, lumps, or lesions. No signs of critters. Okay. Sanitizer. Okay, so now I am going to continue palpating. I'm going to palpate your lymph nodes first. Can you tell me if you have any pain or tenderness?
Nope.
It's all good. I'm going to do your sinuses. Any pain or tenderness?
Nope.
Okay, perfect. And now I'm going to do your jaw. Can you just open and close it? Any pain?
Nope.
Okay, no signs of TMJ. And now I'm going to see the range of motion in your neck. So can I have you go forward, back, and then side to side? Okay, range of motion is good. Any pain throughout that? And so now I'm going to palpate your trachea, which is midline. I cannot palpate your thyroid gland, indicating no goiter, and I'm going to have you swallow. Swallowing reflex is intact. And so now I'm going to assess the face. And so I can see that your eyebrows are symmetrical, the hair is appropriate, eyelashes are full as well, your eyes are symmetrical, the sclera is white, the conjunctiva is not red or inflamed, you have green iris, and you have no problems with vision, correct?
Nope.
Okay, and so now I'm just going to test your eyes. So first I'm going to have you just look straight ahead, and I'm going to shine a light in to test your pupils. And good, the other one. Perfect. Pupils are equal, round, and react to light and able to accommodate. Now I'm going to test your peripheral vision. So can you just tell me when you see my fingers?
No.
Peripheral vision is intact. Now I'm going to do the cardinal fields of gaze, so I'm going to have you follow my pen. Please only go with your eyes, not with your head. Cardinal fields of gaze are intact. Sensory motor is intact. No problems with vision. Now I'm going to move on to the ears, which are appropriately placed, symmetrical, no drainage apparent. Any problems with hearing?
Nope.
Okay, so I'm going to perform the whisper test. I'm going to say 2 words, and I'm going to have you just repeat them.
Ocean. Blanket.
Okay, and again, the ear is appropriately placed, no signs of drainage, and no problems with hearing. So now I'm going to move on to the nose. The nose is midline, symmetrical, appropriately placed and sized for the face. There is no drainage or problems with smell, correct? And I'm going to test the patency of the nares. I'm going to have you put one finger like this and blow in, and the other side. Patency of nares is good, no signs of a deviated septum. So now I'll continue on to the mouth. The mouth is midline, symmetrical, no cuts or lesions on the outside. I'm going to have you say ah. Uvula is midline and intact. The teeth and gums are healthy. Teeth are clean, indicating good oral hygiene. The mucosa is pink and moist, indicating good hydration. Tonsils are not swollen, and the tongue is also pink, moist, and intact with no cuts or lesions. And I palpated your trachea, and I did that. So now I'm going to test your range of motion for the upper extremity. So what I'm going to have you do is move your arm in a large circle. Any pain?
Nope.
Okay, no signs of crepitus, and bend your elbow. Perfect. Any pain?
Nope.
No signs of crepitus, and twirl your wrist. No signs of crepitus. Just let me know if you're having any pain, okay?
Okay.
Twirl your arm and a big circular motion. No signs of crepitus, and bend and flex. Perfect. And one circular motion. Perfect. So no pain throughout that?
Nope.
No signs of crepitus. The skin is warm and dry to the touch. No visible lesions, cuts, or anything of that nature. I'm going to assess your skin turgor, which is good. No tenting. Capillary refill is under 3 seconds. So I'm going to assess this bilaterally. And again, good skin turgor, no tenting, indicating good hydration. Capillary refill is under 3 seconds. Nails are clean, cut, and trimmed. So now I am going to have you just stand up for a moment, please. And I'm going to have you walk down and back to assess your gait, which is stable, no unsteadiness, balance and coordination are fine. So now I'm going to have you step out a little bit, and I'm going to have you stand on one foot, and then the other. Perfect. No signs of balance problems, and gross motor function appears to be intact. So can I just have you take a step that way, and then turn this way? And I'm going to assess for crepitus and range of motion in your lower extremities, okay?
Mm-hmm.
So I'm going to have you lift your leg up and go forward, back, out to the side. Any pain?
Nope.
No crepitus. And bend your flex your knee. Any pain?
Nope.
No signs of crepitus. And twirl your ankle. Good. And now I'm going to do the other side. So pick your leg up, go forward, back, out to the side. Any pain?
Nope.
No signs of crepitus. Bend and flex. No signs of crepitus. And your ankle. Good. Any pain?
Nope.
No signs of crepitus. So now I'm going to have you just go forward and like you're diving into a pool so I can assess for scoliosis. So I'm palpating the spine. I see no deviation from the midline, indicating no scoliosis. You can come on back up. And now I'm going to have you face this way. And first I'm going to have you take a deep breath so I can test chest expansion. Good. Okay. So my hands move out and away with her breathing, indicating good chest expansion. When I inspect her, I see no barrel chest, and she appears symmetric. So now I'm going to go ahead and assess her lung sounds. And so whenever I move my stethoscope, I'm going to have you take a deep breath, okay?
Okay.
Okay, and I'm going to have you turn around, face me. And just a few more deep breaths for me. Perfect. Okay. And now I'm going to go ahead and assess your heart sound, so you can just breathe regularly for this. Okay. You can go ahead and sit down. So, lung sounds were clear, no signs of crackles, rhonchi, wheezing. As I said, chest is symmetrical, no barrel chest, no difficulty breathing, no signs of dyspnea, nothing of that nature. And heart sounds were also good. No signs of murmur, no dysregularities in rate rhythm or anything of that nature. Now I'm going to have you lay down for a moment. I'm going to assess your bowel sounds, and I am going to auscultate for your aortic and renal arteries. So upon inspection, I can see that the abdomen is not distended, and there's no cuts, lesions, or anything to prohibit me from auscultating. So I'll begin with the bowel sounds. Okay, and then the aorta. Perfect. Okay, so bowel sounds were not hypo or hyperactive. They were normal, and I was able to auscultate both of the arteries with regular, not bounding pulses. Now I'm going to palpate. I have no distension of the abdomen, which is good. Okay, you can go ahead and sit up. So now I am going to test your fine motor skills. So I'm going to have you go like this, touch your fingers to your thumb. Perfect. Okay, now I'm going to test your cranial nerves. I'm going to have you smile and frown and puff out your cheeks and raise your eyebrows. Perfect. And now I am going to have you raise your shoulders. Okay, so cranial nerves and cranial and accessory nerves are intact. Fine and gross motor skills, as we already discussed, are also intact. Now I'm going to have you recall those 3 words that I said at the beginning.
Boat, shell, and car.
Perfect. And so patient's short-term memory is intact, and she is able to recall things recently said to her. Now I'm going to take a moment and assess her pulses. So first is her carotid. Strong, easy to find, not bounding, not weak. Radial pulses are strong, +2, equal bilaterally, no discrepancies. And I'm going to assess the posterior tibialis, which is also strong, and the dorsalis medialis, which I can also feel is strong, +2, not bounding, no irregularities, equal bilaterally. And I'm just going to take a minute, make sure I've done everything. I'm just going to assess your skin on the bottom, which is warm, dry to the touch, the same as the upper extremity. And I believe that is it. Do you have any questions for me?
No.
Okay. Thank you for coming in.